Good afternoon, and welcome to Adam Alliance Leading and Sustaining Systemic Change Collaborative Kickoff. On behalf of Adam Alliance, I want to thank you for taking the time to join us. We appreciate all you do to improve quality and achieve better outcomes in the care of our elders. My name is Beth Hersher, and I'm Quality Improvement Advisor for QSource of Tennessee, and I will be facilitating our call today. This kickoff event today is to both acknowledge you for your dedicated effort to your quality improvement and for your participation in this nursing home collaborative. We have over 670 nursing homes across our 5-state alliance that are participating in our collaborative. Your commitment to this nursing home collaborative is vital to the success of our initiative. Before we get started, I do want to introduce to you my Tennessee colleague, Julie Clark, who is also a Quality Improvement Advisor for QSource of Tennessee. Julie is going to be our call moderator today. So, Julie, would you please provide our audience with some instruction and information about our phone lines and also about our chat function of our event? Thank you, Julie.
Absolutely, Beth. And I am noticing in chat right now that the conference line is telling some of the participants that it's full. So we will follow up on that, and but the problem is there on the audio section of this conference call, but there's quite a few that are stating they're having trouble getting in on the line. But for excuse me, for those that are on the line right now and able to hear me, I have muted all of the phone lines, and this will provide us some better listening environment without all the background noises. We will not be holding a Q&A over the phone lines during this presentation, but we do have the option for you to use the chat box, which many of you are already using. Thank you for that. The chat box will be monitored by me during this webinar, and if you would like to send a message to all participants, you can do that, and then there is also an option where it says send to. You can select my name, Julie Clark, if it's a question or comment you want only myself to see. So that will be a way for you to communicate to us during the webinar and a place for you to ask those questions and make comments. The other option for you on questions at the end of this webinar is to reach out to your point of contact in your state, and the presenters will be talking a little bit about that in a minute. Polling is another feature of the WebEx event that you are sitting in on today. The polling will take place throughout the webinar, and when the polling opens up, you will have 30 seconds to complete it. And in order to cast your poll, you're going to need to scroll down to the bottom of the polling box and hit the submit button, and then that will send it out to us so that we get that information. It will take about 20 to 30 seconds for us to get the results, but then we will talk about those a little bit. And I believe that is all that. We're going to see if we can figure out the phone line issue, and I'd like to turn that back over to you.
Great. Thank you, Julie. Appreciate that. I now want to introduce you to May McDaniel, and May currently serves as the Quality Improvement Advisor for Information and Quality Healthcare, or IQH, of Mississippi. And May is going to share with you our objectives for today, and as well as introduce you to our Adam Alliance Nursing Home team. May?
Thank you, Beth. And again, welcome and thank you for attending the webinar today. The purpose of this webinar is to introduce the Adam Alliance Nursing Home team, to give an overview of the QIN/QIO program, to introduce the Leading and Sustaining Systemic Change Collaborative, and to discuss steps to begin your QAPI journey. And now let's introduce the Adam Alliance Nursing Home team. In Alabama, we have Liz Posh and Beth Green. In Indiana, we have Kathy Highbarker and Kara Dawson. Tennessee is Beth Hersher and Julie Clark. In Kentucky, we have Scott Gibson and yours truly in Mississippi. I am so excited to be a part of such an awesome team, and I'm looking forward to working with all of you. Now I'll turn it back over to Beth.
Thank you, May. Now we want to just go through some of the restructuring that our QIO program has undergone, this current contract. Many of you may know this, but we thought it would be good to kind of recap that for you. Historically, the quality improvement organizations, or QIOs, of course you know this, were made up of single organizations within each state across the country. And with this new contract, as of August 1st, 2014, CMS did regionalize the QIO program. So what you're looking at is a map that reflects the 14 regions that make up the Quality Innovation Network QIOs, or QUIN QIOs. And as you can see from the map, there are some states that have as few as only 2 states partnering together. And like our alliance, which is the light blue section there in the corner of the state, central part of the state, is our ATOM Alliance. And this is that section kind of blown up for you. We are Q-Source of Indiana, Kentucky, Tennessee, and we are also partnering with Alabama and Mississippi. So this is our 5-state alliance partnership, and you've probably seen some of the information come across with this new logo, ATOM Alliance, and that is just our branding, if you will, to kind of bring our partnership together. We are still individually Q-Source, Tennessee, Kentucky, Indiana, and of course ACLOF in Alabama and IQH in Mississippi independently. But together we are ATOM Alliance, and our alliance spans from the Great Lakes to the Gulf Shores. So we are so excited to be a part of this partnership, and with you, our nursing home providers. So, again, what is ATOM Alliance, and what is QUIN QIO? Well, ATOM Alliance, as well as the other QUINs across the nation, are serving for you resource professionals that are forming, facilitating, and managing learning and action networks, or what we are calling a LAN. That might be some new terminology for you. You're familiar with collaboratives, but because of this restructuring and this for the QUINs, we are now much larger and able to bring together important initiatives, bringing together healthcare professionals, patients, and other stakeholders around an evidence-based agenda to achieve rapid, wide-scale improvement. So we're very excited about this restructuring and what this is going, and how important this is going to be for you, the provider. With that, I want to introduce to you a very special guest that we have with us. We have Christine Teague. She serves as nurse consultant for the quality improvement task area for CMS, and she is going to speak to us a few words from CMS. So, Christine, I'm going to turn it over to you now. Christine, are you on mute? Julie, can you hear me? Julie? Hello?
If Christine is on the line, it is *2 to unmute.
Scott, were you able to hear me?
I can hear you, yes.
Okay. Well, I wasn't sure what was happening. I know Christine is on the line. I can see her. I'm not sure if she's muted or if her line got muted. Well, I apologize for this delay. So Christine was going to just give us some information around the CMS quality strategy, which are the QUIN QIOs are grounded around these foundational principles, the CMS quality strategy. Some of you may be familiar with it. I know the hospital acute care settings are very familiar with the CMS quality strategy. But as we move forward and with our initiatives, we'll be building upon these foundational principles to enable innovation, foster our learning organization, eliminate disparities, and, of course, strengthen our infrastructure and data systems. So those are just some of the aims around the CMS quality strategy. Along those lines, we wanted you to get an overview of our National Nursing Home Quality Care Collaborative. For those of you that may have worked with us during this last scope of work or previous scope of work, which we refer to as the 10th Statement of Work with CMS, CMS did ask the QIOs to roll out the National Nursing Home Quality Care Collaborative. That is where we were providing the CMS QAPI tools and resources. So what I'm going to introduce to you now is Beth Green, who is the Quality Improvement Advisor for Alabama Quality Assurance Foundation. And Beth is going to kind of give us a look back at the National Nursing Home Quality Care Collaborative and then fast forward into the current national goals that we'll be developing for you with our collaborative. So, Beth?
Good afternoon. Can you hear me?
Yes.
Thank you, Beth, and good afternoon to everyone. And I just want to say that I'm delighted that we have reached the point of our collaborative kickoff. And I want to thank each of you for what you do every day to make nursing homes a better place to live, work, and visit. So as Beth said, I will provide you an overview of the National Collaborative, providing a look back to our previous statement of work, and then moving forward to our current statement of work. CMS will use composite scores to monitor participating facilities' improvement with a goal of 6 or lower to be achieved by 2019. So the current collaborative will be carried out by Breakthrough All Teach, All Learn collaborative methodology staged in 2 18-month phases, led nationally by CMS, regionally by Adam Alliance, and locally by Adam Alliance individual states. The CMS mission statement is to, number one, ensure that every nursing home resident receives the highest quality care, and number two, instill quality assurance performance improvement practices, eliminate healthcare-acquired conditions, and dramatically improve resident satisfaction. So this slide provides a look back, if you will, to our previous statement of work. So prior to the CMS 10th statement of work, CMS conducted a pilot to allow for intensive observation and on-site data collection in high-performing nursing homes. The CMS methodology targeted high-performing nursing homes, identified systems and processes that contributed to their overall quality, and focused on successful practices of high performers with a specific focus on healthcare-acquired infections, healthcare-acquired conditions, and antipsychotics. And what they discovered was in order for real change to occur, the foundational practices and culture must be based on change concepts that have been proven to be effective and provide the desired outcomes. From their study, CMS developed two significant things came out of this. The change package and QAPI at a glance. The change package this is a living document to provide a list or menu of strategies, change concepts, and actionable items to assist you and your QI teams in making change happen. The change packet was compiled through the on-site and interviews conducted last year with the nursing homes that met the criteria to be selected. We will be reviewing these change ideas in greater detail during our action period time, where you'll have an opportunity to test some of these out in your facility through PDSA small tests of change. This will be part of our collaborative in the upcoming weeks and months. QAPI at a Glance Toolkit is a step-by-step guide to implementing QAPI in your nursing home. You'll be hearing more about QAPI later in our session, and at our first learning session in May. So these are the goals of the National Nursing Home Collaborative. Improve the National Nursing Home Composite Quality Measure Score, improve resident mobility, reduce antipsychotic drug use in residents with dementia, increase resident satisfaction and quality of life, and the ultimate goal to improve systems leading to improved care. So again, these are the national goals selected for improvement over a 5-year period. As Beth Herschel mentioned earlier, one of the changes in this scope of work is the structure of the work from 3 years to 5 years. So the change in structure gives us more time to accomplish the goals of this collaborative. And it's also important to note that your nursing home may not necessarily work on all of these goals. The goals of your nursing home should be driven by your nursing home data. What does your data identify to be the opportunities for improvement and high priority areas? So in closing, I would ask you and your team to think about how well do you currently use data to identify opportunities for improvement and high priority areas. Thank you so much for your time, and I'll now turn the program back over to Beth Herschel. Beth?
Thank you, Beth Green. We appreciate that overview of looking back to the National Quality Care Collaborative. Beth mentioned the CMS pilot that was really the impetus for the National Nursing Home Quality Care Collaborative. So we do have that information. It is posted on our dedicated webpage. The report is titled Nursing Home Best Practice Evaluation. You may be interested in downloading that and hearing more details about that pilot and the National Nursing Home Quality Care Collaborative. I want to introduce to you now Scott Gibson, who is a Quality Improvement Advisor for QSource of Kentucky. And Scott will be introducing to you our Leading and Sustaining Systemic Change Collaborative. You're going to hear how Adam Alliance will build from the National Nursing Home Quality Care Collaborative goals to deploy a 3-focused approach for use for our collaborative. We're going to do that by promoting the adoption of quality assurance performance improvement, utilizing peer coach teams to serve as mentors and role models for all of the participating nursing homes. You'll also hear how we're going to use the framework and the methodology that we'll be using to deploy our collaborative, as well as an introduction to the nursing home composite score. So, Scott, I'm going to turn it over to you.
Scott, sorry, this is Julie. Can I just bump in for a second? About the phone lines, I have been on the phone with the provider, and they said that you should be able to dial in. So all of those that are writing these notes on chat, I have sent a message to them. If it does not work, he did tell me that the only way to reset it would be to have everyone end the call and then dial back in. It would definitely be fixed then. But we're going to see if they can dial in at this point and launch that over the next couple of slides, Scott, and then we'll decide what we need to do. Thank you.
Thank you, Julie. Okay, now we'll talk about the Leading and Sustaining Systemic Change Collaborative. We call it the LSSCC for short. Basically, it is the way that the Adam Alliance team will be dealing with those national nursing home quality collaborative issues. We can go to the next slide. Here we go. We learned a lot of lessons in our previous scopes of work. We've found that effective leadership is definitely critical to deploying and sustaining the improvements needed to achieve all those national goals. As Beth mentioned earlier, we do have basically a 3-pronged approach. The first is quality assurance performance improvement. The next is that structure that we're borrowing from the IHI model. And the third is the use of our peer coaches. Now, our collaborative is going to be for the next 18 months. This first collaborative started in April 1st of this year, just a few weeks ago, and it will continue to September 30th, 2016. There will be a second collaborative within the 5-year period here. That will begin on April 1st, 2017 and conclude on September 30th, 2018. Now, the two collaboratives will be very similar. Now, the second collaborative, just because you've been in this first collaborative here, doesn't mean you can't join the second collaborative when that becomes available. Certainly, CMS is going to come up with some new tools and resources. Some of the lessons learned and some of the barriers we find within this collaborative, we will take those and create the better second collaborative as well. To the next slide. We talked about this briefly, the IHI model for improvement. This is the methodology we're going to use to deploy our collaboration. The Breakthrough Series on Quality Improvement developed by IHI. It is an all-teach, all-learn. Yes?
This is Julie again. I'm so sorry. Our other participants have tried to dial in, and the open voice person had told me it may not work, that everyone would have to disconnect and then redial in to get everyone back in on the call. So do we want to go ahead and do this? We have 277 attending the webinar, but only about 100 of them have been able to get in. Beth, your thoughts on having everyone hang up and dial back in?
I think we probably just need to hang up and dial back in. Okay, let's try that, and I do apologize. So I guess hang up and everybody try to dial back in. And we'll pick up where we started. We won't start from the beginning.
And it's just the phone feature, so you can stay on the webinar with WebEx. You just need to dial back in on the 888 number.
Okay.
There's people putting in now that they're in. Oh, now they are in. Oh, my goodness. That's not good, because now they're saying they're in. Okay, it might have just taken a few minutes.
Okay, Scott, why don't we go on and
sorry. Yeah.
Thank you.
Yes.
Okay, great. It looks like we've got quite a few folks who are now able to get back in. I will just briefly, hopefully some of you have been reading the captions. I see a few of you have. The Leading and Sustaining Systemic Change Collaborative, it is our approach in the ADAM Alliance, that's what we're calling it, to meet these national nursing home goals. We are using the IHI model for improvement. It is an all-teach, all-learn methodology, which basically means it's not going to just be the folks from ADAM Alliance and the folks from CMS standing at a podium preaching out all of these different techniques and different things to you. It's going to be all the nursing homes involved working together in a collaborative to learn the best ways to care for our residents. It's going to involve the QIO faculty working with leadership and all of these. Now you can see this IHI model for improvement. We have already begun the pre-work. That's what this call is. Next month, we mentioned the first learning session. We will have that learning session virtually, just like this. Hopefully this time the phone lines will be working and everyone will be connected. After that, we'll take a 3-month period called the action period. And that's where we'll take everything we've learned in that phone call and actually go ahead and start doing that. We'll work with everyone in each individual state, working on the QAPI methodology and all the knowledge gained during that learning session. And we'll have several of those at the end of the collaborative in September of next year. We will have our Outcomes Congress. You see some of the things there. We've got technical assistance, the website, social media, et cetera. We do have a dedicated website. We will get into more of that a little bit later in this call about some of the resources that we have on that site. There we go. QAPI is a transformative approach to quality in nursing homes. We know some of you are using QAPI, you just might not be calling it that. QAPI, Quality Assurance Performance Improvement, is a CMS-mandated strategy. It's not yet a regulation, it's still pending, but it is a change from gathering data and putting out fires, so to speak, to getting all the staff and residents, and even family members on board with proactively strengthening systems and testing changes in a process to see if improvements can be made. QAPI is the framework for this collaborative. It's really the basis of everything we're doing. It is a little bit different. We've all heard of pay for performance, and we're trying to figure out exactly where that's going in the nursing home realm. QAPI is basically the backbone of that. It is a standardized quality measurement. It is something that's going to be sustainable, and it also supports performance improvement. This is something that the whole facility, the whole team can be involved in, not just leadership, not just your administrators and DOM. We want someone from each unit or each department to be involved in this because everyone needs to have a say. It does create a culture of quality. We found the key characteristics of effective leaders. Here are some of those on this slide. We want to equip nursing home leaders with the competencies required to deploy and sustain QAPI. And when we look at leadership, that doesn't, again, just mean administrators and DOMs. We're looking at everybody in a facility, whether it is a CNA, an RN, someone from the maintenance staff, someone who can stand up and take charge and be responsible for all the changes. We also want to look at policies and procedures, not look at who did what or who didn't do something, but look at how can we change a policy or procedure and make something, make that change a positive thing. We'll take a quick look at the QAPI step 1, which is leadership, responsibility, and accountability. It is up to facility leadership to set the tone to help staff identify how to meet the organization's mission, vision, guiding principles, standards, and expectations. On this slide, you're going to see some ways leadership can take action. First is to develop a steering committee. Again, it's not just about the administrator. It's not just about the DOM. It's about everybody involved in the facility. Excuse me. So we want to make sure that we have all the equipment and training available. You know, if you tell somebody to put a puzzle together and they don't have the box, they don't really know what the puzzle is supposed to look like. So we want to make sure they have everything, all the resources they need. Part of that training is what we're talking about with the learning sessions and the action period. And we want to make sure that there's open communication and respect. Everybody at the table is basically on the same playing field. Next, we're talking about Kotter's 8 steps of change. You know, there's always different guidelines and different things, but Kotter's 8 steps of change is what we're going to be using in the Adam Alliance. John Kotter developed a fun way to teach his 8 steps of change, and it was with a book called Our Iceberg is Melting. Basically, it's about a penguin colony in Antarctica where a group of penguins they realize, at least one of the penguins realizes, the iceberg they're on is melting. And he goes to leadership and says, okay, here's what's happening, it's melting, what do we do? And so they have their 8 steps of change. And the first is to create a sense of urgency. You want to make sure that you realize and you let others realize that this is something that needs to happen now. Then you build a guiding team. Again, that's your steering committee. Those are the folks that are from each and every department who are involved in making some of these decisions. Then we develop a change vision and strategy. We come up with what is our future supposed to be. We're here now. Where do we want to be in the future? That committee is what the team that works on that. Step 4 is understanding and buy-in. Then you take everyone from that team and you spread that out through the rest of the facility. It's not just about here's what we're doing, you have to get on board. It's making sure that they understand why and how. And then we step into the next step, empower others. This is, again, giving the tools, resources, the training, and making sure that they have a role in this. It's not just the team saying, here's what we're doing, get on board or else. We want to develop some short-term wins. You can always, you know, you see a year-long process and you say, well, that's going to take 12 months to do. How about every month we have a short-term win? We look at weight loss and we look at saving money. Dave Ramsey has a nice program, Snowball Effect. It fits very well with this. You pay off small debts first and you keep on moving and moving and you have that, those short-term wins. The 7th step, don't let up, be relentless. Never want to let up until the new way of life is firmly established. Step 8, create a new culture. Again, this is where we are and where do we want to go. We want to make sure we are heading toward that new culture. We don't want to be overcome by stubborn, hard-to-die traditions. We don't want somebody stepping in saying, we always used to do it this way, or we've never done it that way. So those are the Kotter's 8 Steps of Change. If you've not read Our Iceberg is Melting, it's a very short book. It's a very quick read. And it's kind of fun. It gets you interested in all kinds of different things, especially the penguins. The next slide are the penguins that we've been talking about briefly. We're going to, in just a moment, have a poll that will pop up on the right side of your screen. While I'm reading through all of these descriptions, think about which of these penguins suits you the most. Now, if you have a room full of people, you can each individually to yourself think about that. Whoever's closest to the computer, just go ahead when the poll pops up, click whichever one you think applies to yourself. Now, this can be something that you can talk about later after the call, figure out who's more like which of these penguins. So look at these real quick. Alice is practical. She has a reputation for being tough. She gets things done. She's focused on the goal at hand, knows the colony, and doesn't back down. She's smart, but not arrogant. Next is Fred. He's younger and open to all new ideas. He's overly curious and very observant, and he's anxious to please. He's level-headed. He's a thinker. He's creative. And he's so new to the team, he's still very wide-eyed. He's willing to volunteer for everything. Buddy is trusted and well-liked. He's happy to help, but he's not an intellectual. He's always present, but he never really contributes any big ideas. Lewis is the head penguin in charge. He's very patient, wise from experience, overly conservative, calm, respected by most, and he's open to new ideas only when supplied with ample evidence that they're needed. No is negative. He does not like change, and he's closed to new ideas, even when there's need for them. His favorite comment, we've never done that. The professor, he's scholarly, he's an intellect. He prefers working with data over coming up with solutions. He's always happy to help, but he does have an introverted personality. We'll take about 30 seconds. Hopefully we'll get that poll up here. We can find out which of these penguins do you think you are more like. And again, as you're looking at that, click the little button next to the name. Make sure you scroll down there to the Submit button so that we record that. If there are multiple people in the room, whoever's at the computer, closest to the computer there, just click that. And again, remember to hit Submit. Now, this story tells an important lesson that when leadership, middle management, and frontline employees are all on the same page with regards to change, it's amazing what can happen despite adverse conditions. Melting icebergs come in different forms. Product lines age, schools become irrelevant, and especially in healthcare services that decrease in quality, business strategies that make increasingly little sense, new strategies whose implementation is sinking into the ocean. Now, we'll take a second here to tally all of those. Let's see. We have several who are Alice, several who are Lewis, and then everywhere in between. So not bad. I figured we would have a lot of Alice's there. So as you're looking at that, think about who in your organization can champion change, who are some of the naysayers, and you personally, what can your role be? All right. So we talked about QATI, we talked about the IHI model, and looked at some change, 8 steps of change. Now we're going to talk about the Peer Coach program. Peer Coach program, in and of itself, is not really a new concept. It's just a new way of looking at things. One of the ways we're going to be supporting all the nursing homes in our collaborative will be through this Peer Coach program. Adam Alliance has selected nursing homes across our 5 states that are going to be serving as peer coaches. They were selected due to being in the top 10% of the National Nursing Home Quality Composite Score. And we'll take a look at those composite scores in a second, talk a little bit more about those. The nursing homes will be forming peer coach teams from within their nursing home. They will be made up of diverse levels of nurses and staff. And there's going to be mentoring opportunities as well. Those are going to be coordinated by the QIL point of contact in each state as the opportunities are identified. The purpose of all this is to link peer coach teams with nursing homes that are challenged to succeed. For instance, if there's a home who has succeeded in reducing antipsychotic use, they may be able to help others through sharing some of their own barriers that they overcame, sharing some of their own successes, and their lessons learned. Again, it's not just somebody, who's in a suit behind a desk telling you, well, here's what you need to do. It's actually somebody who's in a nursing home who's dealt with these same issues day to day, come up with a solution that actually works, and then they can share that. Again, it's that all teach, all learn concept. We're going to quickly talk about the composite score and what that means, and then we'll take a look at a couple of examples that were apparently very real world, and then we've de-identified all of that as well. The composite score, again, it's a relatively new thing, is comprised of 13 long-stay quality measures, and I'm sure everybody on the call is familiar with those measures. We will take a look at those in a second. It is calculated as the sum of all of the numerators divided by the sum of all of the denominators of those long-stay measures. Multiply that by 100. The lower, the better, and it is based on the opportunity model concept. The two vaccination measures are directionally opposite. They are actually higher the better, so we basically just flip those on their head. The composite score is not a replacement of the five-star system. It's simply another way to look at quality from a systems perspective. As it was mentioned earlier, the composite score, CMS is looking for a score of 6.00 or better, and again, lower the better. They want at least 50% of the nursing homes that we're working with in this collaborative to reach that 6.00. So we're going to take a quick look at a couple examples here. The first example, you can see that red line, the number there, 6.22, that is the composite score. And again, that's based on the mathematical equation I talked about a second ago. You can see the immunizations, the vaccines, they are very high, 100% for flu, 91% for pneumonia, very good score. You can kind of see the outlier there, the big blue column, the antipsychotic use. That's definitely at 34%. That's a little more than anything else there. And if I was to walk into a nursing home, that would be the first thing I'd look at. I guarantee that if we could bring that number down, if we could find out what's behind that issue, we could bring the composite score down to a 6 or below. In the second example, you can see it's a little bit different. The immunizations are still very good, but we do have some issues with incontinence and ADL decline. The composite score, because these numbers are all a little bit higher, is now to 9.02. I can't speak for the other states. I know that's about the average for Kentucky, which is where I am. So we do have a little bit of work to do. But certainly if I was to walk in here, it would be incontinence and ADL that I'd be looking at first. In the next slide, we've got the trends in the composite scores. You can see we will be doing some quarterly reports. We'll be getting those to all of the facilities we're working with. And this is an example of what that report will look like. It will show some trends. It will show what your facility is looking like as far as the composite score. We can actually compare to all the other folks in the state, all the other folks that are in the collaborative, and then the national composite score as well. You can see where you've been and how you rate among all those other demographics. And then next we have one more polling question. The question, do you currently use quality measure data to identify your missed opportunities within your facility? It's a simple yes or no. Remember, you have to click the little button next to the answer, and don't forget to hit submit. And as you're looking at that, if you don't currently use quality measure data to identify missed opportunities, that's fine. That's actually one of the things we're going to be working on. As we implement QAPI, we will help interpret that quality data. We'll be working with each and every one of your facilities on that. I believe, okay, the poll is ended. We're going to take a quick look there, see how you guys have answered. And a moment now. Okay, here it comes. All right, actually, a vast majority, 134 of you said yes to 18 of you said no. So it's very good. And again, as a reminder, if you did say no, we're going to be working on that. It's one of the many things we're going to be working on in this collaborative. And with that, I will hand everything back over to Beth Herscher.
Thank you, Scott. We appreciate that. And Scott covered quite a bit of information, so I'm going to just do a little recap. We certainly appreciate you giving us the introduction to our Leading and Sustaining Systemic Change Collaborative. You heard about the framework that we're going to be using, which is the IHI Model for Improvement. That's where we'll have learning sessions about once every quarter, and then in between those learning sessions, we'll have an action period time. As we move into this work of this collaborative, we will be developing a calendar of activities, and that will be provided for you so you will know exactly when those learning sessions will occur, and then also what information and assignments you will be doing during those action period times. He also reviewed with you the peer coaching program. We are developing that for you as a resource for you. We will be giving you that information as we move forward. And then he did share with you about the composite score. I'll be sharing a little bit later on a mechanism that we have developed for you to utilize to download those composite scores. So we certainly appreciate that look. He did cover an evidence-based resource talking to you about John Cotter's work for the 8-step change model. And the interesting thing about that work, it does align nicely with QAPI. Cotter's work really causes you to take a look at the change that needs to occur within belief systems within your facilities. And so that does align nicely with QAPI, and we'll be developing that for you on each one of these virtual learning sessions. And just remember that the virtual learning sessions are going to build upon each other. So as we move forward with this collaborative, we'll be developing that for you as we go forward. I now want to introduce to you Kathy Highbarker. She's the Indiana Community Manager for QSource of Indiana. And Kathy is going to be providing you an important step to begin your QAPI journey or even any performance improvement project, and that is with taking a readiness self-assessment or a self-assessment. So, Kathy, I'm going to turn it over to you to talk about the QAPI self-assessment tool. Kathy?
Thanks, Beth. Well, now we're going to start and move on to step 3 of your QAPI journey. Step 3 of this process is to take the QAPI self-assessment that CMS has provided. The purpose of the self-assessment is to provide a baseline of what needs to be accomplished to have an effective QAPI system within your facility. The assessment contains statements that you should answer with input from your entire QI team as well as leadership. This will help you identify where you are and where you want to be. You can use this like a roadmap to break the task up needing to be completed into small, achievable goals as you move with your project forward. CMS is expecting all nursing homes to complete this self-assessment at least annually throughout these next 5 years. Slide. The electronic QAPI self-assessment tool was developed in an attempt to make it as easy as possible to complete and submit this tool to your state QIO contact. The QAPI self-assessment tool and tip sheet we will be sending to all of you through your state contact. So let's start looking at the tool and how to complete it. When you start to complete the tool, make sure, these are key points, that you're using a computer that has internet access and email access. You also need to have Adobe 8.0 or newer version for this tool to work correctly. So check those 3 things before you start completing the tool. Then complete the tool starting at the top and put in the date that you're completing the tool and select a date at least annually to repeat the self-assessment. Your team may decide to complete the tool more often as your team develops your QAPI process and you need to reevaluate your progress as you're moving forward. As you complete this tool, read and answer each statement thoughtfully. These statements may contain content of the future regulations. After reading each statement carefully, have your team assess where you think your facility rates on that statement. And to assist with the rating on how close each statement fits your organization, place the cursor over a category box, wait a few seconds, and a text box will appear with the descriptions of what that category expectations would be if you would choose that. And you can see it on the slide, the little text box that popped up. So read each description of the text box and then decide which best describes the process in your facility and put an X in that box. Continue to complete the 5-page self-assessment, reading each statement and placing an X in the box that best describes where your facility is currently. Then at the end of the 5-page self-assessment, you see at the bottom on the left, there are blue boxes where you need to fill in your facility information. Fill in the information, then on the right is another blue box that states, click here to submit the report via email. If you push that blue box and you get a message from your computer stating you're unable to proceed with this function or this is not an allowable function, then again, just make sure you have that most current Adobe version, 8.0 or higher, and you have the internet and email access because this form will not work without those things in place. If you're still having problems at this point, just go ahead and save a copy for yourself, print and scan, and email to your QIO contacts for your state, and those will be listed here just shortly, so you'll know who those are. Slide. Otherwise, when you click on the Send via Email box, it should work like this. You'll see an email message with the QIO contact person who will receive your self-assessment tool. So at this point, all you have to do is click the Send button, and this form will be sent directly to your QIO contact. Now, I want to assure confidentiality of this information. It's only used in aggregate format by the QIO to identify educational needs, but your individual facility, tool, or data is not shared with anyone else. If you've completed a self-assessment tool like this in the last 6 months, either by hard copy or through some software package that your nursing home may use, we can accept that QAPI tool that you've completed as the baseline, and you do not have to complete another one. But you do need to make sure that your QIO contact gets a copy of that tool if you've completed that in the last 6 months. After we've had the opportunity to work with several nursing homes to complete this tool, we have discovered some of the problems and answered many of your questions. And so we put together a tip sheet that will help you as you're completing this tool. The tip sheet, along with the QAPI self-assessment tool, will be sent to you by your QIO state contact. And on the tool, if you don't have Adobe 8.0 or newer, the tip sheet includes a link to download the newest version. So always look there if you're needing to update your Adobe version. And if you still continue to have problems, it's fine just to print, scan, and email the assessment tool back to your state contact. And the state contacts are all listed at the bottom of this tip sheet, so you will have their email addresses. Remember, as you're doing this, always save a copy of your tool that you've completed for yourself, so you'll be able to continue to look at it as you progress forward and do the next self-assessment. Okay, we have a polling question for you again. We're very interested in knowing how many of you maybe have already completed a QAPI self-assessment in the last 6 months. So on the polling question, if you would either answer yes or no, you have completed a QAPI self-assessment in the last 6 months. So you click on your answer, and then at the bottom again, if you will click on the submit button. and that'll take a few minutes. So while we're waiting for the polling to be displayed, can I have the next slide? We'd like to request that you complete the QATI self-assessment by May the 22nd and submit to your QIO contact as part of the preparation for the first learning session. Since QATI is data-driven, please review your composite score data by May 28th. Composite data will eventually be available through provider.exchange. This is a secure data portal that is under development on our website. So until the completion, the data will be sent to you by your state QIO contact, and that contact then will notify you when the provider.exchange is available for use. As your team is organizing, think about a person who would be a good champion for your participation in this collaborative, someone that will lead your team and move your organization forward. Okay, let's look at the polling question. It looks like the majority of you have not completed your QATI self-assessment yet, and looks like 53 have. So the group that has completed your QATI self-assessment, please make sure that your state contact gets a copy of that, and then that will be your baseline, and you will not have to repeat that. Everyone else then, you will be receiving this from your state contact here in the next week, so please complete your QATI self-assessment and return it by May 22nd. Here's a list of the agenda topics for Learning Session 1. We'll be starting to progress through the 12 steps of QATI and the 8 steps to Leading Change by John Cotter. Our first learning session will occur on May 28th from 1 to 2:30 Central Time or 2 to 3:30 Eastern Time. Invitations will be sent out soon, so be looking forward to those in your email. At this time, I'd like to turn it back over to Beth Herscher to go over the remainder of the presentation.
Great. Thank you, Kathy. The next few slides, I want to just share with you some of the evidence-based resources and tools that we have that we'll be utilizing throughout this collaborative. The tools that you see on the screen here, you're probably familiar with many of them. There are a couple, the Cotter's 8-step and Team steps, that are probably new for you. But quality assurance performance improvement, we'll be utilizing the CMS website, those tools and resources that are there, as well as others. We have developed a QATI companion guide that really walks you through the 12 implementation steps for QATI. It really is taking the QATI at a glance tool that CMS developed, and again, just kind of walking you through step by step. Beth Green mentioned to you about the National Nursing Home Quality Care Collaborative, the pilot that was done, and the change package that was developed as a result of that. Those are really good action items that we'll be sharing with you. Those may be some interventions that you can utilize as you begin to look at your change opportunities and start to do testing within those action period times. So those are some of the resources. Advancing Excellence, many of you already know about Advancing Excellence. We will be working with you on taking a look at those resources that are on that website. They just really are a repository for some great process tracking tools around many of the goals that you may identify as opportunities. So we'll be sharing that with you along the way. But the two newer ones that you may not be familiar with, Cotter's 8-step process for leading change. Scott gave you a little sneak peek into that around the penguin colony and that cute fable that kind of just walks you through those 8 change steps. But again, it's really taking the belief system. It's really incorporating these concepts into the belief systems. And we know that anytime you do change, especially within our nursing homes, that's one hurdle, is trying to get everyone on board and really empower them to believe in the changes that need to occur. So we'll be utilizing that that aligns back to QATI nicely. So we'll be developing that for you within our curriculum. The other one is Team Steps. This is probably new to some of you. It was developed by the Department of Defense and Agency for Healthcare Research and Quality, or AHRQ. We're positive you've heard of that organization. Team Steps is an evidence-based teamwork system. It offers you a powerful solution to improving collaboration and communication within your healthcare facilities. We'll be using the long-term care version of that program to align nicely with your environment. So those are some of the evidence-based resources that we'll be utilizing throughout this collaborative. Another mechanism, there are a couple of mechanisms that Adam Alliance have developed. One of those you've heard about, Kathy had shared with you about providers.exchange. There's really two phases to this. It is a secure portal, if you will. The first phase is ready to launch, and that is where you have an opportunity, especially because we are an alliance now of 5 states. This will be a mechanism for you to be able to interact with one another. It will be a member only, where we will sign you up. We will be getting with you that information, getting you that information, and help you get signed up for that. But this is where you could go in. It's sort of like a social media chat room or forum, if you will. And many of our hot topics will have opportunity for you to go in and do live chat, ask question and answers, have faculty there to answer questions for you. Those topics may be antipsychotic reduction or QAPI concepts and techniques, and others along the way. So we wanted to share that with you, and those details are coming to get you signed up for that. The second phase for this portal will be, it is still in development, but it will be a mechanism for you to download your nursing home composite score. So we're working on that, and that's coming very soon to support you throughout the collaborative. The other resource we have for you, we have developed a dedicated web page. It is a private web page that does live on Adam Alliance website, but it's only for those that are participating in the collaborative. The URL that you see on the screen is the access URL to that private page. That is kind of your go-to. That's where we will be posting upcoming events. After each virtual learning session, if you need to download a worksheet or go to download the PowerPoint, you will be able to find it here. And your point of contact within your state, if you don't have access, if you didn't get access to this PowerPoint, they can get you the URL to get connected to this dedicated web page. So before I close, I do want to review with you some of the action items that Kathy shared with you, because we will be meeting again very, very soon for our first virtual learning session. So we do have a few things that we want you to do to prepare for that May 28th virtual learning session. Immediately following this event, if you have not completed the QAPI self-assessment, as Kathy shared, your point of contact within your state will be disseminating that to you, and we do ask that you go ahead and complete that and submit it. And then we're asking you to review your facility's composite score data. At this point, we just kind of want you to get familiar with it, discuss it maybe with your IDT team, and kind of be thinking, how are we going to utilize these reports? So you can start that dialogue. And then, as Kathy shared with you, go ahead and identify a collaborative champion. This leadership collaborative is really a focus around leaders and effective teams, but your collaborative champion may not be your DON or your administrator. It might be an individual that has that sense of urgency and passion for quality improvement. Someone that has a willingness to learn new approaches, is a consensus builder and a systems thinker. So be thinking of that Alice within your facility, like we shared with the Penguins, that may be your collaborative champion. So we look forward to our journey together in the next 18 months. Following this webinar event, you're going to be receiving a post thank you note from the WebEx host, and you will be able to conduct a feedback survey for us. We really want to get your feedback so that we can improve our format and process along the way. We realize that there are, some technical issues that we have with some new technology that we're learning. So please provide that feedback for us. We do appreciate it. So we look forward to being with you and seeing you on the first virtual learning session, and that invitation will be coming very soon. So with that, we're going to close, and we thank you again for your participation.